The recent monkeypox outbreak in Nigeria has sparked significant concern as the country grapples with the spread of the virus across multiple states. The disease, which can cause fever, rash, and swollen lymph nodes, has become a pressing public health challenge. The Ministry of Health, in collaboration with global health organizations, is working to contain the outbreak through improved surveillance, public awareness campaigns, and vaccination efforts. However, the rapid transmission and limited healthcare infrastructure in rural areas have exacerbated the situation. With the potential for further outbreaks, there is a growing concern to strengthen Nigeria's healthcare system, improve response strategies, and ensure effective coordination between health agencies.
So, as at August 2024, 48 cases of the monkeypox has been reported across 20 states and the Federal Capital Territory of Nigeria. The question is, how can the country manage this outbreak appropriately? To discuss this burgeoning topic with us today, we have with us Dr. Patrick Ikani, Anibbe. The topic of discussion today is managing the monkeypox outbreak, Nigeria's public health response and future preparedness. Dr. Patrick Ikani Anibbe is a PhD holder in public health, and he has over 20 years experience in international development. He has worked extensively in Nigeria's public health sector, teaching, both at home and across the world. Currently, he is the Chief Operating Officer of the Institute of Social Change, Communication and Innovation. He's also an adjunct professor of public health. You are welcome, sir.
Thank you.
Sir, we'll be discussing how Nigeria can manage the monkeypox outbreak. Currently, the National Center for Disease Control has said that we have about 48 cases of, monkeypox infection. Those are the diagnosed cases, the ones that are recognizable. And it seems this is a disease that has a potential for high spread amongst the population. Either due to several conditions that I'm sure you are going to be explaining to us today. So I would like to start off on this note. I want you to give us a brief overview of the current status of monkeypox, and particularly, focusing on how widespread is the infection and what are the key areas of concern that we should have in mind.
All right, so thank you, Sheriff. So monkeypox is, or Mpox, as WHO has reclassified the name. It's spreading widely in Nigeria because the states keep increasing. As of today, 21 plus FCT, which is 22, which is alarming. And again, why it raises concern is that Nigeria is one of the reasons why WHO has declared as public health emergency. Because across the West and Central, Nigeria is still ranking the states with the highest in terms of numbers or the spread. And yes, why is it a concern? And it's across several local governments, over 35 local governments in Nigeria, 34 local governments. So that's a major concern, and the potential of spreading widely across. And then for me in Nigeria, when you say something is 10, there's a possibility of it being 1,000 because our state of readiness, our reporting systems, case identification, and all of that, they are still in poor states, abysmal states that we cannot. And if you look at the transient nature of the sample, when a serum, moving it from one place to a further place, there's a possibility of a positive turning to negative or being reported as being negative. So a lot of factors. And then you look at our awareness creation, to me, it's still very poor because I see that on several media, new and old, try to see what's the level of awareness that is going on in the country. I have not seen one person come to me, see me as a layman somewhere or in the community where I live to really, for people to wake, to be reawakened in the spirit of asking, hey, doctor, what is happening? What is this? Like in the days of Ebola and COVID. So I still think that our situation in terms of public health today, in terms of our response or awareness creation is still low.
Okay, thank you very much, sir, for
Yeah.
that succinct response. You know, you've talked about awareness creation now, like we are not responding properly in terms of I don't know if this responsibility should be saddled more with the government or with the private sector in terms of creating awareness so that we can nip it in the bud before it becomes a serious, very serious health concern for the populace. Well, so currently, what is your assessment of the current outbreak in Nigeria, and how do you think it's impacting public health across the nation?
Yeah, so anything that takes life, takes breath from anybody, anything that causes some level of discomfort to anybody, anything that is transmissible from one person to the other is already a concern in public health. And public health looks from the point of awareness, the points of case identification, the point of making people prepared, making people understand what is close to what is being reported and all of that. So if you look at our situation, it is not. And then if you said who should be responsible, whether private or anybody, it must in public health we use multi-sectoral approach, multi-partner, multi-sectoral, multi-dimensional, well, private sector, everybody's involvement. And if we learn from our experience of COVID, Ebola, at the hip of it, everybody came together and started playing. So I think there's need for the Ministry of NCDC and all its partners because we need this to go to education. We need this to go to schools. We need this to go to the farms. We need everybody to be aware that when you have this symptom, go to the hospital. So this is
All right, thank you, sir. So, this is your last response. I'll still piggyback on it in terms
okay.
of, what do you think currently now the Ministry of Health, what is your analysis of their response strategies, to this outbreak? And I'm talking in terms of, do you think they are properly surveilling? We are carrying out proper surveillance. Is there proper public awareness? Do we have maybe vaccination campaigns as related to vaccinating the populace against it? And um, if so, are those measures suitable, to curb the spread, or what areas of improvement do you think we need to go about?
So thank you. I would say the Ministry of Health, NCDC, they are doing their best. But the best can be there's need for improvement significantly. There are needs for improvement because in terms of vaccine campaigns, and this has been a problem. It should be a learning curve for Nigeria. COVID, we depended on international donors. HIV, we have depended forever for almost 30 years, and all of that. So, what is government investment in this? What is the political power? What are the political will behind this? But if you look everywhere, you read everywhere, the interventions are they receive 10,000 vaccines from WHO, from wherever. So what is Nigeria? Anything that is a public health emergency and you are frontline as a country, you should make investment. And I'm saying that with every sense of modesty. Why the Minister of Health is ensuring that they're trying their best. But do we have the right health facilities in terms of infrastructure to support this? Growing up in our early days, we knew there were epidemiology centers in local governments or what we call public health centers in local government. They could escalate when there were no phones. They could pick up something and go. But what is the state of those across the country today? NCDC can be uppermost in terms of their role. They are mirroring international. They are mirroring what WHO wants to see or CDC. But how do we have replicate of such in the states, in the subnational level? I think these are things of concern. So in areas of improvement, I think Nigeria has opportunity to learn from this. And what are the opportunities? Since we have a bit of poor diagnostic tools, infrastructure, we have HIV that's pulling a lot of resources into the country. The PCR machines are across the geopolitical zones in Nigeria, and these are the same instruments. All you need is to buy the right reagents and program them to be able to analyze them. They are all DNA PCR based. So all we need to do is to be intentional that this is a population-based crisis in public health, and the only way we can do is to integrate and collaborate internally and look at existing structures and see how we can improve. In terms of improving our awareness, public awareness, Nigeria also has a great opportunity. We have national orientation agencies across the local governments in Nigeria. They have speakers and mic. We have the traditional systems where people blow trumpets or the chiefs and engage them meaningfully. Engage our religious leaders. The mosque on Fridays, the Christians on Sundays. We can take this campaign, but I have not seen enough of this. So I think we need that meaningful engagement to ensure that at little or no cost, people are fully aware. And again, how have we strengthened systems? We are looking at health. Health alone is not the system we need to fight public health entities like this. Do we have potable water across the states? How many people have access to this? How many people can say, I have washed my hands properly? Let's leave those on the farm. Let's look at people at homes. Let's look at children. In COVID, in Ebola, our children learn to wash their hands almost to a point of fading. The adults also learned, but we'll drop those culture. And now we are faced with another thing very close to personal hygiene. So all we need is concerted effort. We need all the ministries and MDAs. We need all the private sectors to come together, not for the interest of marketing soaps like happens or sanitizers like happened during COVID, but for intention of a sustainable way. Provision of water across schools, across homes, across communities, especially the rural areas, even the urban areas. In FCT, how many places have potable water, access to potable water? So these are things that we need to look at. And for me, we need every hands on deck to be able to ensure this.
All right, thank you, sir. And talking about strengthening our systems and the role of the private sector. The Nigerian Economic Summit Group has been involved in strengthening Nigeria's health system. The NESG currently has a health policy commission, and as at August of 2024, there was a pre-summit event. That's a pre-Nigerian Economic Summit 30 event, with the title Strengthening Healthcare Regulatory Bodies in Nigeria. And some of the discussions from this, from the conversations that happened at this pre-summit webinar actually led, to the Ministry of Health setting up, a committee that is tasked. The committee is actually tasked with establishing a National Health Facility Regulatory Agency. So we believe that part of these activities are aimed at strengthening Nigeria's health system. So I'm really glad that you brought that up. So the NESG as a private sector-led think tank is actually doing a bit of work, when it comes to the health system. So moving on from that, let's now, I'll still go back to infrastructure because it's part of what you mentioned, in terms of the importance of infrastructure, in nipping out all these outbreaks so that we don't continually go back and still say, we were able to get, ahead of COVID, ahead of Ebola. But, if we don't continually talk about infrastructure or we dump all the infrastructure we use the maintaining that is going to be an issue. So I'll ask, how do you evaluate Nigeria's current healthcare infrastructure, particularly as it relates to the rural areas? I'm talking about in terms of their ability to manage outbreaks, such as they've managed in the past, COVID, but particularly as it relates to monkeypox. How do you evaluate their infrastructure to manage this, and how can we strengthen as a nation? How can we strengthen healthcare delivery in such areas?
Thank you very much, and thank you, NESG, for the great work you do around the private sector. So when you see Nigerian health systems in rural, I'll say fair. Government currently is making efforts at across the 774 local governments to ensure that at least one PHC works effectively.
So that's a primary healthcare center.
A primary care center, and that is the closest to the people. Now, again, we have a lot of opportunities around all the other ones we have done. Viral infections are viral infections. Our approach to managing them in terms of control measures, preventive measures are all almost similar. Wash your hands, avoid close contact, avoid multiple sex partners, and all of that, which is also same with Mpox. So if we keep this running, so in terms of infrastructure, like I said, across these LGA, proxy to those LGA, you definitely find a PCR center. In one state, you must find one. At least I know that across geopolitical zones, you will find one. So if we have that access and we have linkages from the PACs, even from private sector, that synergy does not exist. What you find is that government don't surveys, their surveys are limited to public health facilities. The private sector, if I ask many of you, many people have not visited one single public health facility in over 20 years, and your family are like, especially those who deal with HMOs and some level of health insurance. So government needs to be intentional, like I said earlier, to start taking stock. Who has XYZ infrastructure? In Abuja here, you have big hospitals. If you go to Sokoto, you go to Kano, you have private sectors that are thriving. And then know what the public sector provides. At least there are still people who can pay out of their pockets. Let government have a directory of this infrastructure. Yes, so in terms of monkeypox, Mpox to be specific, case identification and all of that, lucky case identification standards guideline has been set by NCDC. So it is like any common clinical diagnosis. Any very simple thing that any private doctor can do, any health professional, even down to our CHUs and the JCHUs in the local government, they can find.
Those are the community health,
community health extension workers, because we are looking at basically looking at fever and all of that, which is common thing they deal with every day. Now, when it advances to rash and all of that, they will be able to look at that. But how well have we taken trainings to them to be able to do that? So in terms of our infrastructure, I would say, yeah, we are fair in terms of standing, not the high-level diagnosis. But at least the first thing is to find all those who show symptoms to Mpox. That's the first level. After that, we move the samples. And it's sample movement. So we can take dry samples, we can take different kinds of samples to the reference labs, and there are three. But then, how also have we, in terms of these connections, how well have we trained them on sample collections, sample storage, sample transportation, and then what are the communication channels between them and the reference lab? And then how functional? I mean, yes, I know that the reference labs are working very well, but in terms of support systems to ensure that they work around the clock, these are things that government also need to start thinking about. So I would say infrastructure at the lower level in terms of identification and all of that, we're fair, we're in good standard, we can do better. Yes.
All right. Thank you, sir.
Yeah.
Lovely response in terms of we still need proper coordination between the private sector and the public sector. But now I want us to focus on coordination even between agencies. You made mention of the fact that we can be in Abuja, the Federal Capital Territory, and have large hospitals, large government-owned hospitals, large reference laboratories. But you could go to certain states and you have an issue finding that.
Yeah.
So is it, can we term it as a lack of coordination between the federal, the state local governments, and maybe local health agencies? Considering that you earlier mentioned that there's a need for primary healthcare centers to be present a lot in rural areas, which is like the primary point of contact for people in those areas.
Yeah.
So how would you access, or do you think there exist gaps in terms of coordination between federal, states, and local governments, and also with the health facilities?
Yeah, so everything Nigeria is that we are trying our best, but I will not rate it very, very well. I would say we are suboptimal in terms of where we need to be, and coordination is the word poor will not be appropriate. I think it's still suboptimal because coordination that we're talking about involves. If you look at our tertiary facilities, there's naturally outside Mpox or outside outbreaks, they are not coordinated. The Federal Ministry of Health controls teaching hospitals and all of that. The state government controls general hospitals and the PACs are at the local government level, also controlled by the state, except with this current autonomy. So you discover that in getting things right, one WHO wants one health system, one health reporting system, one health, one M&E, one everything, monitoring and evaluation, one strategy, one approach. So, but you discover that states do whatever they want to do. That coordination is not there. There are no meetings to bring people. As Mpox has come, we expect our commissioners of health or the National Council on Health to have an emergency meeting to summon them and deploy these guidelines. Yes, some of these guidelines are even deployed from NCDC, but are they implemented? Are people capacity built on these new trends? Do they implement as is written? Do they have ordinary personal protective equipment that goes to state? And you find out that some states they can't find. Putting the health people, the health professionals at the risk, and they are frontline. So how many states have invested in, since Mpox came, let's buy more lab coats, more protective equipment, and generally, let's ensure that we have retraining as it relates to Mpox case finding and all of that. So that coordination is absolutely poor. But in terms of document transfer, policy transfers, they are online, they go to NCDC sites, they download whatever they want within the confines of what they can implement or the cost they have, they just make do with it. But we expect that NCDC, we know there are situation rooms in some states, but are they across the country? The answer is no. So these are things that these situation rooms are built. Emergency call centers are working across, even beyond the states, at the sub-local government levels, the LGs, which you have in clusters, which you have a reporting center where they coordinate from there to the state level and the NCDC. And then how do we support them in terms of communication? What are the channels available to them? Is it their personal phone, their personal credit to call? And then what are the movements? Do we have ambulances? We have isolation centers as when extreme cases exist. These are things that we need to. What are the incentives for private sector? The private sector is a businessman, and then the public health announcements are done within the public health sector. The private man is there, he's not aware, or even if he's aware, he's there to maximize profit. So how does government engage them meaningfully to ensure? So this coordination must not be government to government. It must be all round. Private engagement, private sector engagement, even the traditional practitioners, because you can pick up case from a trado medical practitioner in the community so that he knows, when it's like this, wash your hands, report when you see rashes, you don't see it's demonic, it's anything. So because there are also cultural things that comes with it. Thank you.
Thank you. This your mention of cultural and socio-cultural barriers, will form the basis of my next question, and that is, you just mentioned a list of challenges we have, in our health sector that doesn't just relate to combating the current monkeypox outbreak, but with also but to also other diseases and other challenges. Yeah. So now we are looking at you mentioned a certain the government involving traditional practitioners. So I would like you to just highlight for us some of the cultural, social, logistical barriers. You've mentioned some of them earlier, but I know probably you missed some that we need to address to effectively combat the spread of monkeypox itself.
So if you look at every disease that comes, every disease comes with fear. The outbreaks generally in public health before it's made, and then when WHO takes a step to say these are a public health emergency, global, it raises fear. Issues of stigma and discrimination becomes a crux. You are going to see when they say you have rashes and so on. Before now, maybe it's demonic. It's actually, when you have this kind of thing, they throw jazz at you or you have matched something. And then, so that will not go away with Africans, especially us in this part of the world, in the entire Africa, not only in Nigeria. People will always align things with the supernatural things or beliefs that they hold, and it will not go away quickly. And so people end up, and that's why I said intentionally we need to engage traditional homes, traditional treatment homes and all of that, because people will go into those hideouts. And before you know, you have a boomerang you have an explosion within the community. and this is a body-to-body contact. Then again, people must eat. They must eat animals, and this is zoonotic in nature. So I was passing Uchafa just last weekend, and I was passing. I saw people drinking palm wine and chewing and biting all kinds, and some of them are. They could be cats, they could be monkeys, and they could be anything. And these are things that are even rodents. People use rats. People eat rats. And as it is, when you have such outbreaks or emergencies, there's still a lot to understand. A lot of research is going on. Tomorrow it could be another animal that is also incriminated in those who transmit, the primary agents who transmit this. So we can't run away from it. So when somebody have that, there's a tendency of abandoning him, not reporting his case. There's a possibility of multiple, and we love our people. So when one reach the breadwinner is sick now, everybody will want to touch and feel what it is. And then they get infected, they move on, and people don't have ready water supply at their beck. So these are many and many more that we can think. And stigma and discrimination kills and also makes disease spread so fast.
Thank you, sir.
Yeah.
So now we'll just move on. We understand some of the challenges that the country is facing. Both at the federal, states, local government level, and even at an individual level for people.
Yeah.
You talked about lack of access to potable water. Talked about stigma that people face, and an array of other challenges that we have in combating this. But I would like us to focus on individuals now, on the individual level. How can the regular man on the streets protect himself and his or her family from, contracting, monkeypox? I would like you to focus on specific preventive measures that, you as a public health specialist, with over 20 years experience, I know you've seen various different types of diseases. You've worked on various types of projects, on some of the pandemics that Nigeria has faced over the years. So I would like you to just recommend to the general public, what are the specific preventive measures they can adopt to risk getting infected with monkeypox?
Okay, so if you want to stay out of infection, you want to stay out of disease, take personal efforts. Your personal safety is very key. Washing of hands, even with any disease in the world. If you wash your hands more frequently, you are likely to escape it. Multiple sex partners and all those who indulge in men who have sex with men, there are higher chances of acquiring monkeypox. And then, so you avoid multiple sex partnership. You deal with your partner and also use protective equipment if you must have sex with multiple partners. Again, hand washing is critical, and we must take campaigns of hand washing to homes, to schools, to market squares. Not only campaign, not temporary measures that we did during Ebola and COVID, but put permanent structures. Not you just create one ad hoc pump that people use dirty hands to fetch water inside and they wash with their hands when it's no longer safe. So government needs to invest to support the community. So at individual level, yes, we expect that people reduce their interaction with animals. We know rodents are there. Monkeys are the origin, and the rest of them. So dead animals, when you are in contact with them, please bury them properly, wash your hands safe. Contact with anybody that has some symptoms of monkeypox. So you see the journey for washing hands. If I shake hands with you, I wash my hands. So I would not even know whether there are symptoms of pox coming in another person. So if we do that more frequently at individual level, we will. Then at individual level, if you feel you have obvious cases, if our campaigns have been strengthened, if you feel you have this kind of case, go for vaccines. At least it's been proven that 85% of those who go for vaccine, which is a great success, whether post or pre, do well. So if you have access to vaccine, please take those vaccines. I know there will be hesitancies and all of that, but that's still. Then, if you feel you don't have access to vaccine, report yourself. Isolate yourself as much as possible. Avoid contact where you have crowd. Body fluids and all of that are also incriminated. So don't exchange objects with your family members or your close pals in terms of using some
objects.
beyond sharp, even sponge and every other things that's likely, so that you can stay safe. I think these are the few that comes, but within the health sector, the health professionals, we expect them to use their PPEs, their personal protective equipment. And when they see cases that are obvious, please report it, collect the samples, ship the samples in good time so that case can be identified. I think those are the things at individual level.
Thank you, sir. So earlier you talked about, we have a vulnerable, obviously for every disease, there are a vulnerable set of people that, that are more vulnerable to catching those diseases. So are there specific groups, particularly as it relates to, monkeypox, like specific groups that are vulnerable to, to contracting monkeypox, and how can the nation, now, we don't want to put the onus on just the federal government. How can the federal government, the state government, the local government, and even private sector individuals and concerned non-governmental organizations, how can they ensure that such populations receive the necessary attention and care, needed during this particular outbreak that the nation is facing?
All right, so thank you. Yes, they are. I mentioned a couple of them in my very concluding conversation. Of course, if you are immunosuppressed, if your immunity is low, generally, you are at the risk of acquiring monkeypox. Children suffer. Pregnant women, because it's transmissible to the unborn child. We also have the key population, and specifically men who have sex with men, those who have multiple partners, sex workers, and the rest of them. So it is only important. And I know that the Ministry of Health with international partners usually prioritize, they call them priority populations. Mostly these priority populations across disease entities are usually women of childbearing age, children, immunocompromised people who have tuberculosis for a long time. These people have multiple sex partners. Those are the key pops. And so they are being prioritized, and most times they are usually prioritized for vaccination. Campaigns are always there. I can guarantee you that apart from us, the rest of men especially, and monkeypox, I think the reported cases in Nigeria and across the region, there are more men, male than female. And the campaign has not reached us. I don't know how much the rest of you have heard. So, but I know that in hospitals, because women go more frequently to hospitals, the key populations have access to some close information, and they belong to some high-level social groups. So they share most of this information. So, yes, but that is not enough. We need to step up such campaign. But those are the vulnerable populations. But I think everybody needs to be careful, because when something is new, from 2017 till now, it comes and goes and it keeps going on. So we need to really do a lot of research to also find out who else is a vulnerable population.
Thank you very much, sir. So I would actually love to end on this note. We've talked about Nigeria's preparedness, current preparedness in terms of this monkeypox outbreak. We handled Ebola well. We got kudos for handling it well. We did relatively well with COVID, at least to curb the spread. So presently, monkeypox is here, and we are trying to do our best to also, control the outbreak. Now, how would you assess, or do you believe that the country is currently prepared for future, public health emergencies, either pandemics or whatever public health emergency we face? And what proactive measures do you think we can take, beyond addressing this current monkeypox? What are the proactive measures that the country can take, or that you would personally recommend as a public health specialist for decades, that you recommend to enhance Nigeria's capacity to handle similar cases that may occur in the future?
Yeah, so why I say Nigeria is trying, I said there are rooms for improvement. And it's a lot across Africa. We're reactionary. We're waiting for pandemics or things to come, and then we'll start reacting to them. If you look at our health appropriation in the country, it's still poor. Even with the little increase that the current president said they will do, that is, if you look at it vis-a-vis the population of the country, over 220 million people, which a country that has not done census
for years,
over
decades.
over 2 decades or more. So estimates are not appropriate, and we don't have the right bet numbers and all of that. So I think we're not doing so well in terms of preparedness. We need to have standard systems, sustainable structures, both laboratory, clinical diagnostic equipments across the states. I'm not talking of the region, because we have PCR spread across the country, and government can invest more. Once we have this, we have a budget with NCDC, and we say this. Then we need to strengthen the proactive measures we need to have is to strengthen our, not only depending on bilaterals, but also looking at our multi-partner, our MDAs together, have a stronger synergy where we come to the point of also determining what happens in Nigeria. Not when money comes, the people who bring the money decide what happens. So we need to have a strengthened health systems or interdepartmental and interagency that this is more like a task force, exactly, that is there and continue to respond to things and put up sustainable systems where we say we have lab. Look at ECPOMA in Irwa, for instance. What's that? Irwa has been known for that, but how many centers have been replicated outside Irwa for the rats? What is it called again? Okay, so I remember. So it's very important for us to have systems that people can wake up any day, not when it becomes a pandemic or when WHO announces. We wait for them to give us vaccine. We should be able to buy these vaccines and put in country. 10,000 for 220 million, or we look at the vulnerable population alone, the number is not good enough, it's poor. So we need to have very proactive measures in terms of addressing our own needs, not waiting for somebody to address our needs for us. Our lab infrastructure in terms of training, in terms of upgrades, they need to be there. We need to upgrade our labs to an ISO standards where they can respond to world-class emergency. And that is money for Nigeria, because other countries can actually come here to plug in their samples and we make money. Then it's our own. We're waiting for Ministry of Health. We are waiting for Ministry of Education, or this is not willing to join and all of that. Those things has to stop. So we have to have very formidable teams. In terms of guidelines and all of that, how do we operationalize them? We must have frameworks that work, not frameworks that are there by mere announcement of books. So these are things that I think, and we should take some of this enlightenment into schools curriculum. People are graduating from public health. People are graduating as medical students. They don't know about Mpox because the curriculum is over 30 years there. And so any new thing is just there. So when these things come, let it be learning for those in training. So as they come also, they join in the crusade of fighting it. So I think these are things that I think we can do to step further so that we strengthen. Then government, political will, at the governors forum, at the local governments, all of them, they must meaningfully engage the private sector. Let us map private sector. Let us know what capacity different private sector hold across the country, so that when we have things to donate, we can easily send it out and say, oh, we are supporting XYZ. We can support them to subsidize cost. We can support them to make it free. So these are things that I think Nigeria needs to do. Let's reduce our total dependence on our public health facility, which are in dire need of help.
Thank you very much. Thank you very much, sir. It's been a very enlightening conversations, and I hope our audience also enjoyed every single thing that we've done. We've discussed today. I hope you have learned about various preventive measures, that you can use to combat, monkeypox. And we also hope that, our leaders, people that are in charge of policies and, that have the opportunity to make a change are also listening, because we feel that these conversations, you have a whole lot to do in terms of, ensuring that Nigeria is prepared for any future outbreak that we may face. Okay, thank you, sir, for being here with us. And to our audience, thank you for joining us on this interesting episode of NESG TV, where we discussed how we can manage the monkeypox outbreak. For years, the NESG has had various impacts in different sectors of the Nigerian economy, and the health sector, is not left behind. If we can remember, during the COVID-19 pandemic, the NESG actually led, an intervention of the private sector known as the Coalition of the Private Sector Against COVID-19, which is CACOVID. And this coalition ensured that, Nigeria had more PCR testing, that's the polymerase chain reaction testing, were deployed across the nation. More facilities were created, and they ensured that they stuck to biosafety procedures. And we also expanded the capacity, for contact tracing, tracking, and isolation of infected people. Furthermore, the NESG also deepened communication and messaging throughout, the entire COVID-19. This is just one of the numerous activities of the NESG, the numerous impacts we have had on the Nigerian society and Nigerian economy at large. So we continue to call on, our private sector partners for sustained efforts in this regard. And we also believe that through active collaboration with the public sector, Nigeria can, we can all witness the Nigeria of our dreams. Once again, I would like to call on all of us, to join us at the 30th Nigerian Economic Summit with the theme Collaborative Action for Growth, Competitiveness, and Stability. It will be happening from the 14th to 16th of October, 2024 at the Transcorp Hilton Hotel, Abuja. Don't worry, if you can't attend physically, you can always join in virtually. And if you want to register, kindly visit www.nesgroup.org/30. Thank you, see you at the summit, and see you on the next episode of the NESG TV.